Today, I will explain in detail the types of wisdom teeth, situations that require extraction, and precautions to take after the extraction. Wisdom teeth are the last molars to emerge and usually begin to appear between the late teens and early 20s. However, in many cases, there is not enough space in the mouth, or the teeth come in at an incorrect angle, which may require a consultation with a dentist. Wisdom teeth can be classified into three types: wisdom teeth that have erupted normally and straight outside the gums; partially impacted teeth, where part of the tooth is covered by gum tissue; fully impacted teeth, which are completely buried within the gum and bone. Fully impacted wisdom teeth are further classified into four types based on their position and angle. Mesioangular impaction refers to teeth tilted forward toward the front of the mouth. Horizontal impaction refers to teeth that are lying completely on their side. Vertical impaction refers to teeth that are positioned upright but remain buried and do not erupt through the gums. Distoangular impaction refers to teeth tilted backward toward the rear of the mouth and is considered the most difficult type to extract among the impacted wisdom teeth. The most difficult type of wisdom tooth to extract is the fully impacted one. Among the different types, mesioangular impactions are relatively easier to extract. They are followed by horizontal, vertical, and finally distoangular impactions, which are the most difficult due to the gum and bone covering the rear portion of the tooth. Wisdom teeth do not always need to be extracted. However, extraction is necessary in the following cases: when there is persistent pain or discomfort, gum inflammation, or a high risk of cavities or periodontal disease due to food getting trapped around the wisdom tooth. In particular, if the wisdom tooth is angled toward the adjacent molar, it can affect the front teeth as well, and in such cases, extraction is recommended. On the other hand, extraction may not be necessary in the following situations if the wisdom tooth has erupted normally and straight, does not negatively affect surrounding teeth, and there is no pain or inflammation. In some cases, when a molar is missing and the wisdom tooth is healthy and strong, it can function as a replacement molar, and in such situations, it is better to preserve the tooth. After wisdom tooth extraction, stopping the bleeding is the most important part of recovery. The reason you are advised to swallow your saliva, including small amounts of blood, is to help form a blood clot, which is essential for proper healing. For this reason, the use of straws and smoking are strictly prohibited, as they can interfere with blood clot formation. If bleeding does not stop properly, complications may arise, so it is very important to be cautious. Here are some precautions to follow after wisdom tooth extraction. The gauze placed in your mouth right after the surgery should usually be removed after about 1 hour and 30 minutes. Applying a cold pack for 2 days can help reduce swelling. Avoid spicy food, hot food, and hard food for a few days. You should also avoid using straws for at least 3 to 4 days. When brushing your teeth, avoid the surgical area and brush gently. Do not rinse your mouth forcefully. Smoking and drinking alcohol should be avoided for at least 1 week. Lastly, swelling and pain may occur for about 48 hours after the extraction. However, if severe swelling, pain in the throat area, or a low-grade fever continues beyond 48 hours, you should visit your dentist for a follow-up consultation. An accurate diagnosis of the condition of your wisdom teeth and a proper treatment plan can be made through a dental examination and X-ray imaging. If you experience discomfort or suspicious symptoms in your daily life, it is highly recommended to visit a nearby dental clinic for a consultation.